Definition of cough. A cough is a reflex action where your body expels air to clear your airways of irritants like mucus, smoke, or foreign particles. It can be voluntary or involuntary and is an essential protective mechanism to keep the airways clear. Types of cough. 1. Acute cough, lasts less than 3 weeks. Commonly due to colds, flu, or infections. 2. Subacute cough, lasts 3 to 8 weeks. Often persists after an infection like bronchitis. 3. Chronic cough, lasts more than 8 weeks. Often associated with conditions like asthma, GERD, or chronic bronchitis. 4. Productive, wet, cough, produces mucus or phlegm. Common in infections like bronchitis. 5. Non-productive, dry, cough, does not produce mucus. Often due to irritants, allergies, or early stages of infections. 6. Nocturnal cough, occurs mainly at night, often due to asthma or GERD. 7. Whooping cough, pertussis, a bacterial infection causing severe coughing spells followed by a whoop sound. Causes of cough. 1. Infections, common cold, flu, bronchitis, pneumonia. 2. Chronic conditions, asthma, chronic obstructive pulmonary disease, COPD, GERD. 3. Allergies, dust, pollen, animal dander. 4. Environmental irritants, smoke, pollution, strong odors. 5. Medications, certain blood pressure medications, ACE inhibitors. 6. Lung diseases, tuberculosis, lung cancer. 7. Postnasal drip, mucus from sinuses dripping into the throat. 8. Smoking, chronic cough is common among smokers. Treatment of cough. 1. Medications. Cough suppressants, for dry cough, e.g., dextromethorphan. Expectorants, help clear mucus, e.g., guaifenesin. Antibiotics, for bacterial infections, e.g., pneumonia. Antihistamines/decongestants, for allergies or postnasal drip. Bronchodilators, for asthma-related cough. Proton pump inhibitors, PPIs, for GERD-related cough. 2. Home remedies. Honey, soothes throat and reduces coughing. Gargling with salt water, reduces throat irritation. Humidifiers, keep the air moist to relieve dry cough. Hydration, drinking plenty of fluids to thin mucus. 3. Lifestyle changes. Avoid smoking and exposure to irritants. Manage allergies with medications or avoidance strategies. Elevate the head while sleeping if suffering from GERD-related cough. 4. Consult a doctor. If the cough is persistent, worsens over time, or is accompanied by other serious symptoms like chest pain, weight loss, or blood and sputum,